Hello everyone, I'm Dr. John Jameson, and it's a pleasure that I have a chance to visit with Kevin Henry from Dental Economics to talk to you today about the office design program that they sponsor along with Wells Fargo. To look at judging practices year after year, we get a chance to follow up on what the common trends are. And from the time that I began judging many years ago until now, the pro forma that we watch for each of the practices has changed as it has evolved into something that meets the needs of the practices today. Before, when we first began judging practices, there was no technology, there was no clinical workstations, there was nothing like that. And today we've seen these things evolve into having that be commonplace. It's a standard of design that we look for to make sure that everything meets the standards to meet the type of care that doctors need to be providing today. What stands out to me in most cases is the tremendous time and effort and vision that the doctor has been able to give to a design group to be able to put that together for them to meet the goal that they have for the practice that they're developing. And it meets everything. It has to meet how they function in the business systems, how they function in the clinical systems, how they then look at even the financial portion of it, how they finance the development of this activity to make it a reality. If you're wanting to enter, seek out a professional design group to help you make that happen, along with interior decorating care and touch, to make sure it meets the needs that you want for your practice. In other words, the vision you have for your practice, what are we able to make happen to get to that level? And for anyone that is looking at entering, I recommend that you have a professional photographer come take the photographs that go into that application. Now, for many years, we've been looking at things in binders, and I know that in the future we're going to be looking at photographs digitally stored, and that will be a very easy process for us to be able to adapt to. But you've got to give us the best, because we can only go by in the judging process by the information that's sent to us. This is for any practice that's putting together a new vision, because we look at patient flow, we look at the design of the treatment area, we look then at a variety of things that go beyond what I would call the Taj Mahal, or in many cases has gotten to the level of even gauche, because a lot of those are over-adapted in how the doctor wants to make a statement, and we want to look at something that's going to be profitable for you. We don't want you designing a facility that's going to drive you into bankruptcy. We want you to have something that's going to be functional for your career path and be a real good part of your career long term. One of the important things that you do as you're beginning to look at a long-term project program for you is you've got to have financing for this activity. Now, some doctors are blessed possibly with advanced capital to be able to develop this new facility for themselves, but most have to have financing. And you want to look then for those organizations that are dental friendly to make sure that they understand what your dental future is all about and be able to give financing appropriately to be able to accomplish the goals that you want to. You don't want to go in with a master plan and have the financing become a concern after the fact, and then you have to begin to adjust. We want to be sure the financing is in order as the final plans are developed, and we can then make that part of your long-term positioning.